Have you ever felt low after sex? It might be a surprise to some, but this phenomenon, known as postcoital depression, is far more common than you might think. It's an issue that often goes undiscussed, shrouded in the shadows of societal norms and personal embarrassment. Yet it's an important one to address, to understand, and to normalize. This isn't about pointing fingers or casting blame. It's about understanding that sex, like any other human experience, can have an array of emotional aftermaths. It's time we talk about this, postcoital depression. So what exactly happens after the climax? It's a hormonal roller coaster. Let's dive into the science of it all. During the act, your body is flooded with hormones such as dopamine and oxytocin. Dopamine, often referred to as the feel-good hormone, is responsible for that wave of euphoria you might experience. Oxytocin, on the other hand, sometimes called the love hormone, is associated with feelings of bonding and emotional closeness. But here's the catch. Once the act is done and the climax is reached, these hormone levels plummet. It's like being at the peak of a roller coaster and then experiencing that sudden stomach-churning drop. This abrupt decrease can potentially lead to feelings of sadness, anxiety, or emptiness, a stark contrast to the euphoria experienced just moments before. This is not to say that sex is bad, far from it. It's just that the hormonal aftermath can sometimes be a bit of a downer. In a nutshell, your hormones just took you for a ride. But it's not just about hormones. There's a psychological aspect too. The labyrinth of our minds plays a crucial role in how we perceive and respond to sexual experiences. Postcoital depression isn't always about the body's biochemical reactions. It can also be fueled by feelings of guilt, shame, or dissatisfaction after intimacy. Imagine a scenario where an individual feels unsatisfied with their performance or their partner's response. This dissatisfaction can breed negative feelings and, if not addressed, may lead to a depressive state. To add to this, our cultural and societal constructs often place immense pressure on people to meet certain sexual standards or expectations. The fear of not living up to these expectations can exacerbate feelings of guilt and shame, further deepening the sense of postcoital depression. Remember, it's not just about what happens in the bedroom, but also about what takes place in our minds. Our mental states are as vital as our physical reactions. The mind plays a big role in this postcoital downswing. And then there's the aftermath. At times, the intensity and passion involved in sex can leave one feeling physically depleted. It's not just about the physical effort, but also about the emotional investment. The emotional highs can be followed by a steep drop, a sense of emptiness that can be quite disorientating. Now add to this the burden of unfulfilled expectations. We all have an idea, a vision of how our sexual experiences should be. When reality doesn't match up to these expectations, it can lead to feelings of frustration, dissatisfaction, even sadness. This disappointment can loom large, casting a shadow over the entire experience, and can contribute to the onset of postcoital depression. It's a complex interplay of hormones, emotions, and expectations. It's not just about the act, but also about the aftermath. The physical and emotional exhaustion, the unfulfilled expectations, they all have a role to play. So it's clear there's more to this post-sex blues than meets the eye. So we've taken a deep dive into postcoital depression. We've explored the hormonal roller coaster that follows orgasm, the psychological impact that can stem from feelings of guilt or dissatisfaction, the fatigue that can result from the intensity of intercourse, and the potential for depression when expectations aren't met. It's crucial to understand these factors, and even more important, to address them. Remember, it's okay to talk about it, because understanding is the first step towards resolution.